I grew up in Albany, Kentucky. That's where I lived all my life until I moved to Bowling Green in 1979. My dad was a welder in Albany, and he had a welding shop. If anybody needed anything fixed, they would come and Daddy would take care of them. If we were sitting down to even eat Christmas dinner and somebody come knocking on the door and they needed something, he was always the first one up to go fix the car or give him a part or whatever he needed to do. And I saw what he would do, and I always wanted to help people. I started attending WKU. I was the first person in my family to go to college, so it was a big event for us. I actually started working as a nursing assistant while I was going to nursing school at WKU. My husband and I got married young and had a child, and so I needed to start work. And so I started working, just loved being a nursing assistant, but then graduated from nursing school, and then I became an RN. And I started taking care of patients on a med-surg floor. And then opportunities came up, and I remember getting a call from someone saying, "Do you want to work intensive care unit?" So an opportunity came up for a management job. Gets me day shifts so I can see my daughter. She was starting first grade, so I thought I need to get off the evening shift and work days. And so that's really how I got into management. My mentor and boss at the time was John Demeray, Mr. Demeray, and the day he called me up to say, "Do you want to be chief operating officer for the hospital?" I said, "I will do anything that you want me to do, but we don't even have a chief operating officer." And he said, "I know, but that's what I want you to do." So that was just a few months. Then I became CEO for the Med Center, and that's how I ended up, I guess, where I am today. I started at Med Center in 1981, and that was only 1 year after we had moved from the old hospital to the new hospitals. And at that point, we had none of the buildings on campus. In the last 25 years is when the growth has really been just tremendous. Several years ago, when we started getting into more of the academic environment, things really did change. Our first public-private partnership was with WKU to build a nursing school on their campus. And so after we did that, then we started working with University of Kentucky and WKU to bring a medical school on campus. Done so many exciting, great things in my career, but the education piece of it is definitely a capstone. It just takes the whole community to a whole different level. I love nursing. I'll always be proud to say I'm a nurse. It really has been priceless from the standpoint of giving me the perspective to understand the organization at a very granular level and to be able to lead and work with people in the position that I'm in today.